Hello, welcome to Zoonosis with Joy. I'm Joy, and today we're going to be talking about canine post-traumatic stress disorder, PTSD, both relating to dogs, but also to other non-human animals. I hope you enjoyed this video. Please like, comment, and subscribe. It really does help the channel. Share it around, and let me know if you want to see more videos like this in the future. So post-traumatic stress disorder is a diagnosis in the Human Diagnostics and Service Manual, starting back in the DSM-5, which came out in 1980. This is a condition that's been described in human patients, but has been extended to non-human animals, particularly in dogs. So when we talk about this condition, we're talking about a psychological disorder, which is manifested by clinical symptoms. When we're talking about animals, we're talking about clinical signs, things that we can observe extrinsically. So all the things that we're talking about is in reference to both analogy, but also homology. Animals have the same sort of neural circuitry that humans do, and we know this because of biological evolution. We are close relatives on the biological tree of life, basically, right? So we're mammals, and that means that we can extrapolate from what we know about human PTSD and start to understand how it presents in animals and what we can learn about that, and how these things can be managed and treated and prevented in the future, that kind of thing. So we've known for more than a century that acute psychological traumas in a certain percentage of the population will manifest as chronic psychological conditions. Back in and following World War I, soldiers that returned home were changed. They showed signs of what was called at the time shell shock. This was a condition that was typified by individuals having persistent flattened affect, but also hyperarousal during periods of acute emotional distress, going back to the moment of their acute trauma, typically loud noises like artillery fire. Now, this had and has a huge social stigma. Individuals that presented with this condition were considered weak men or not real men because they didn't show the proper response of steely resolve in the face of danger and trauma. We know now that this isn't true. There seems to be some individuals who are just genetically predisposed to developing this, but it seems kind of random. About 20 to 30% of individuals that encounter an acute psychological trauma will go on to develop this post-traumatic stress disorder. And we know that children are going to be more likely to develop these signs. They believe because of both the lack of psychological mechanisms to protect and adapt to the trauma, but also because of neurological development is not completed, so the scars run deeper, so to speak. We know that in humans, the typical signs of post-traumatic stress disorder, as described in the Diagnostics and Services Manual 5th edition, typically present with signs of usually flattened affect, so they are more withdrawn, emotionally reclusive. They tend to socialize less, but during periods of what they call the flashbacks, there can be hyperarousal, so there will be acute stress, distress, and this can be triggered by some sort of reminder, either from a recurrence of the trauma or due to something that reminds someone of the trauma. For example, if someone has PTSD that was incited by artillery fire, for instance, a loud noise like a car backfiring or a gunshot can bring them right back to that moment. And there is a period of heightened memory where this individual will be almost like they're exactly back in that same exact location, right? We also know that this is not just isolated to psychological phenomenon. This affects sleep cycles because individuals will have recurring memories of the episodes that occur in dreams, and they'll have disturbed sleep-wake cycles due to this. There can also be substance abuse disorders such as alcoholism or prescription and non-prescription drug use. And there can also be digestive problems as well. So usually irritable bowel syndrome, ulcers, that kind of thing. Dysbiosis too. So all this has been pretty well described in human beings. There are a number of pharmacological and non-pharmacological interventions to manage it. That said, it is a huge problem for not just military personnel, but also survivors of sexual abuse, survivors of natural disasters, and many other people who've lived through abuse and trauma, that kind of thing. But what do we know about it in animals? That's kind of the question in this video. So Animals and humans, of course, they share a common ancestor. This is the central thesis of modern biology, is that all animals descend from an initial life form. So animals share homologous neurological structures in their brain that humans do. And this also correlates to their endocrine systems and that kind of thing as well. So we know that animals have homologous neurological structures, and they show kind of behaviors that are very similar to human beings during periods of acute stress if they've had this kind of previous sort of thing. We know that wild animals also can show signs that are similar to PTSD, and they show neurological correlates to these sort of things as well. So black-capped chickadees that have been previously exposed to predators, when they play the sounds of predator vocalizations, usually like hawks, that kind of thing, they will show heightened neurological activity in the limbic system, particularly the amygdala. This is the part of the brain, it's shaped like an almond, hence the name amygdala, that is responsible for fear, aggression, and anxiety. And it's also responsible for, associated with the dopaminergic systems, which produce dopamine. There's also heightened activity in the hippocampus, the seahorse part of the brain, which regulates memory. So these chickadees, which are wild animals, show certain signs that are very similar to post-traumatic stress disorder in human beings. And if anything from the 20th century, we know that experimentally we can induce trauma-like signs in animals. I talked about this with the Harlow monkey experiments where infant rhesus macaques were traumatized repeatedly at a very young age. I talked about this with reference to dairy cows and the inhumane sort of conditions related to that. So go check out that video. But there's also there's also a huge waft of scientific and experimental evidence done by some of the greatest sadists of the 20th century, experimenting on animals to show that, yeah, you can traumatize them or you can show chronic stress states because of these sort of things. Now, stress and trauma isn't just in the brain, of course, it's throughout the body. The neurological activation of parts like the amygdala or the hippocampus don't just stay there. They go throughout the body in different ways. One of the ways is that it increases the stress cortisol state. So if you know anything about stress hormones, then you can kind of skip ahead. But otherwise, basically, the hypothalamus will send hormones to the pituitary gland. The pituitary gland sends hormones to the adrenal cortex, and this causes secretion of steroid hormones like cortisol and corticosterone. These hormones are commonly found in individuals experiencing chronic stressors. This will lower immunity, increase blood sugar, and it also can cause reduced skin barrier thickness. It can cause decreased gut barrier thickness, that sort of thing. This could be related to some of the gut signs that I was talking about earlier. There also seems to be activation of the sympathetic nervous system. So sympathetic nervous system is like fight, flight, freeze, and fawn. During these periods of flashbacks, individuals may have higher levels of epinephrine and norepinephrine, so adrenaline and noradrenaline for some of you. This causes, increased blood pressure, increased heart rate, that kind of thing, which can lead to heart disease, stroke, and hypertension. All these sort of things which are major causes of morbidity and mortality, not just in animal patients, but in human patients as well. And chronic stress can also change the amount of secretion of the serotonin by the gut in the enteric nervous system. So inside of the gut, back here, there is actually a whole other kind of nervous system that is really independent and interlinked with the central nervous system, which regulates gut movements. But it also is one of the major sources of serotonin in the body. So PTSD can actually change that, which can change microbiome function, which can also cause IBS-like symptoms, ulcers, dysbiosis, all these sort of major chronic diseases of the gut, basically. And we see all of these in dogs. Now, dogs are the most studied species when it comes to PTSD-like symptoms in animals. Part of this is because, humans like to abuse dogs. And I've talked about this in my German Shepherd video. German Shepherds are probably the poster child of PTSD in dogs. Part of this is because they're used for police work and they're used for military functions. There's believed to be about 5% of the 650 million military dogs in the world have developed signs similar to PTSD. So that's probably an underestimate, but that's what they have there. Now, typical triggers for these sort of things are similar to humans, right? Abuse, neglect, and other forms of trauma. Abuse doesn't have to be the actual sort of handler themselves or the owner. It often could also be veterinary personnel, unfortunately, but also dog groomers, that kind of thing. Anything as simple as like quicking the nail or like doing overly aggressive restraint procedures in animals can lead them to a state of fight or flight. And this can trigger kind of PTSD-like symptoms in animals. So when they go to the vet clinic, suddenly they are taken back to that horrible moment where the veterinarian held them down on the table, tried to take their blood and trim their nails and restrain them, pry open their mouth, that kind of thing. So it can be a very distressing sort of state of affairs. And this old school method of veterinary medicine is one I try to avoid as much as possible, because this is something that could damage the animal for the rest of their life, both neurologically but also physically. So this is a thing that is a major problem in veterinary medicine. There is also things such as explosions. Dogs that react poorly to fireworks, sometimes it can be as simple as, they get stressed or lonely, or they begin to associate fireworks with these negative sort of outcomes. But also dogs that have lived through war zones, that have lived through conflict areas, can develop sort of PTSD related to loud explosion noises from human beings. They don't have any capacity to understand what these noises mean. There is also neglect, right? Neglect is different than abuse in that it's a withdrawal of something positive: food, water, safety, shelter, that kind of thing. And this can lead to states that lead to PTSD as well. So there's a number of things that can cause that, and natural disasters too, right? We know that dogs that have lived through earthquakes, tsunamis, hurricanes, that kind of thing, can go on to develop PTSD as well. So there's a number of different triggers that can lead to it. Again, not all dogs that have gone through these sort of things will have PTSD, but owners report that many dogs that have developed this will go on to show these sort of things. So how are these managed in dogs, and what can be done to help kind of manage or treat these conditions? The cornerstone of treatment is actually training. Now, unfortunately, the old school of training, which is kind of what is erroneously titled negative reinforcement, but is actually positive punishment, basically using punishment to stop these sort of behaviors, is widely used even by owners who know their dogs have trauma. About 60% of owners who report their dogs have signs similar to PTSD have reported that they've used positive punishment. And not just them, but also veterinary professionals, also groomers, that kind of thing as well. And so they will use restraint, they'll use loud yelling, they'll use even hitting, shoving, that kind of thing, to try to stop their dogs from becoming overly anxious, that kind of thing. Typically, this is very unsuccessful. This can actually make the dog more anxious. They can actually worsen their digestive and sleep problems, and actually can cause huge setbacks in their training and their treatment, that sort of thing too. Positive reinforcement training is one of the most effective ways to kind of manage this. So if a dog is approaching something that they wouldn't have done previously, you reward that behavior. Praise and treats are some of the best ways to kind of bridge that gap, basically. If a dog has had a previous trauma to certain sort of like people, like men, that kind of thing, using a kind of habituation method slowly can actually make that dog start to have extinction of the negative behaviors that are associated with stress and anxiety. So if there's an individual dog that has, is really freaked out because of firefighters, because it lived through a house fire, then having kind of short positive play dates with firefighters and fire trucks, as long as it's done slowly and introduced gradually, can actually be a very positive way to overcome that trauma and lead to a new kind of positive treatment of that post-traumatic stress disorder. Another method that has been described as well, which I think is a little less described, but has been actually very positively reported by some owners, is called tattling. So if there's a dog who is barking because they see a masked individual, for instance, and they're looking towards their owner, when that dog stops barking and looks towards their owner, the owner rewards that. And this can stop the dog from barking and can reduce their signs of anxiety and actually help manage and treat PTSD. We also know that pharmacological interventions can be very successful. In fact, they may be required for the treatment of post-traumatic stress disorder. A lot of clients, in my experience, are very hesitant to put their dog on psychotropic drugs, even if they have very severe signs of anxiety, even if they're showing signs of aggression and that kind of thing too. And often by the time they come and ask for these medications, it is a very long process to accept the fact that their dog has a psychological problem. But many of these drugs can be very beneficial and have very few side effects in terms of managing it. Now, not all drugs will work for every single dog, and sometimes there is a process of trial and error and trying to figure out which drugs are safest and most effective, that kind of thing. So drugs such as fluoxetine, which is kind of like Prozac, clomipramine, or amitriptyline can show some benefits. Like I mentioned, this can change the level of serotonin in the gut and help manage some of those anxiety sort of symptoms that are related to post-traumatic stress disorder. There's also other drugs that can be used during acute stressor episodes. Now, every dog needs to have their nails cut eventually, so eventually you're going to have to get to a point where you have to trim those nails. How do you do that in a dog that has traumatic memories of being held down on a table and trimmed their nails forcibly? Well, sometimes drugs can help, right? So this is where we start looking at things like trazodone, gabapentin, and that kind of thing. Now, these drugs don't work for every single patient, like I mentioned. Some drugs will actually heighten feelings of anxiety because it makes them feel disoriented, it makes them feel anxious, and it returns them to an even worse state. But a combination of different drugs or trying a different protocol can be very effective. I've had good success using the CHILL protocol, which was developed by Tufts University, which is a combination of ace-promazine, gabapentin, and melatonin. There's also other products like benzodiazepines, which can be used kind of like lorazepam, that kind of thing, which is used for acute anxiety in humans for like flight anxiety or that kind of thing. So those kind of medications can be very helpful during these acute sort of things. Outside of that, feeding a proper diet can be a huge part of it. So dogs that are, have malnutrition, feeding them a regular kind of formulated dog food, that adult maintenance, or even a dog food that's specifically on label for treating anxiety, can be very helpful. There's also things like play and exercise, which can help them get back to a feeling of wellness and overall health. Even if it doesn't have that much therapeutic benefit for this condition in particular, it's always important to let the dogs have a chance to play and live their lives, that kind of thing too. Now, that said, even with all these treatments, this can be a lifelong condition, and dogs that have had trauma in their past can go on to experience recurrence of these signs in the future. And, drugs can help, training can help, but, patience is the biggest and most important thing, and kindness and compassion is very important too. So basically, dogs can show the very same signs that humans can during, from previous history of trauma. Signs of anxiety, signs of flashback, signs of poor sleep, signs of bowel disorders and gut disorders. And this leads me to conclude that in order to build a more humane world, not just for animals, but for people, we got to build a world without war and fascism and patriarchy, that kind of thing. And this is going to be a very hard and long project, and I'm not optimistic about our chances, but it's a necessary intervention, I think. To reduce the frequency of these things, we're going to have to build a world where there's less trauma, where there's less abuse, where there's less disaster. And that is the world that I want to live in, and that's not the world we're living in now. I'm hoping that one day we can build a more humane world for everyone, not just the humans, but the animals that live inside it as well. And if this seems like a far-flung or kind of idealistic sort of world that I'm hoping for, so be it. I think that we should all have ideals and things that we strive towards. But that's what I have to say about post-traumatic stress disorder, specifically in dogs, but some of this applies to humans and other animals as well. So if you like that video, or if you want to learn more, of course, read the stuff in the description. I like to include my sources because I find that's helpful. Share this video around, or if you have any questions or want to see other kind of videos, let me know. I'd be happy to make them. That's all for now. Definitely check out my course that's coming up this summer for domestication syndrome. I'm super excited. I'm going to make more domestication videos coming up soon. And other than that, I will see you next time. Peace.